Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello.
Hey, how's it going?
Good. How are you?
I'm doing well. Thank you for having me.
Thank you for taking the time out from your very busy schedule. We were just talking about it some time back and discussing how busy it can get, work-wise, and you taking the time out. I think you just finished working right now, right?
I did, yeah. Yeah, I'm over here. I'm out in California, so it's not super late for me. So
Yeah.
I just wrapped up seeing some people.
Yeah, but it's still like it's still not a break or not a chance for you to like sit down, stretch yourself. You know how much flexibility is important.
Well, no, this is okay. I don't mind doing any of this type of stuff. So this is
Yeah.
still kind of coming down. So this is still very good for me. It's okay.
This is the reason why I love speaking with fellow therapists and people from healthcare. They we're so passionate. You can see the love and passion for the profession, for healthcare, for helping patients out, and not just that, talking about it, educating more people about the very same thing. I love that. Thank you so much for taking the time out and being here with me today.
Of course. Thank you. I appreciate you doing stuff like this. So happy to share whatever little bit of knowledge that I can kind of piggyback off of what you already tell your followers.
Yeah.
So this will be fun.
Yeah, definitely. It was already fun when we were talking.
Yeah, I know. I forgot that we weren't even like we were about to do a live. I was like, I thought we were just chatting for a while, and then it was like, oh yeah, we're doing this still. Okay.
That's what happens when you're from the tri-state area. You
That's
become
right. Yeah, you
besties.
just link up.
Yeah,
That's right. You just gravitate to each other, right?
definitely. So let me start by asking you my first and my favorite question. What, according to you, is health and fitness?
Say it again. Sorry, it's like at the CrossFit gym here.
That's okay. I'm glad we can't hear it though. So
I know. Yeah, it's
it's
okay.
good. My question to you is, what, according to you, is health and fitness?
Yeah. I think I think health and fitness is a spectrum. I don't think there is really like a start and a finish. I think it's about, meeting you where you are. So I
Right.
think that, I think that as long as you're progressing and you're trying to do something that is aiming to better yourself, I think that's kind of, what health and fitness is. So I think they're one and the same, and I don't really, separate rehab and performance and health and fitness. I think it's just about what are your goals, where are you today, and how can we bridge the gap between the two.
Right. You mentioned the rehab and goals. How much do you think the rehabilitation is important? Injury prevention, as we call it. How much is that important to you?
It's so important, and especially, healthcare costs are um, astronomical, higher than they've ever been, right? So, um, even from just keeping people out of the system, I say, is kind of the goal, because, once you're here, there isn't really, it's only like bad and not so bad, right? It's expensive, it's arduous,
Yeah.
it affects our mental health, right? So, I think preventing it is the number one cure, right? It's just preventing it from happening in the first place.
Right.
Statistically speaking, and even in research, even in preventative care before a surgery, it almost always yields better outcomes. So, anything, again, anything you can do to just get better, always try. Even if you've got the surgery kind of looming, the prehab will help you with your outcomes prior to the surgery. So always prevent.
I have noticed with few of my ACL and total knee replacement cases that when we did, because it's a rule here in US that I really like, we don't have the same thing in India. If you need an X-ray or an MRI or a CT, we just walk in, we just get it done. But here, okay, pros and cons, I understand. But here you need to do PT before even being approved for MRIs or CTs.
Right.
X-ray is still okay, but for other scans, you still need to do PT. That PT has helped the patient so much post-surgery.
Yeah, yeah, for sure. I think, and even just like, if you're worried about something, I think the good thing about that is the images aren't super helpful anyway. We're learning, it's it kind of depends on the body part, the
Right.
issue, but they tend to kind of muddy the diagnostic process a
Mm-hmm.
bit. So even if we can kind of stop it from getting to that point too, I like that in our system. I think maybe there shouldn't be so much friction between getting you the MRI that we all think you might need,
Yeah.
or even if it's just something that you want. Like you pay for the premium, you should be able to just go and get the MRI if you want it, right? So, I think that there are both sides of the story, but I feel like in my practice and in my history, there have been many more times where someone's come to me wanting an MRI that had to come to me first that didn't even end up getting the MRI because it got better. It was kind of like, hey,
Yeah.
well, remember you wanted that MRI on your shoulder, and you're back to the gym, so don't sweat it. And that's a huge component, to preventative medicine.
Yeah. Like you said, you just skip the whole surgical process for that person. Surgery, post-surgery rehab, which can be so painful with all the
Mm-hmm.
medications and the recovery. It seems like, oh, surgery is going to fix everything. No, there's so much pain. There's so much neuromuscular education that you have to do, training you have to do.
Yeah,
So it's more work. And if we can skip all that just by doing PT from the very beginning, it's awesome.
yeah. I always say, like, do it now or do it later. Because you're gonna see me regardless, right? So it's like whether you do it now and you never need the surgery, fine, but you're gonna do it either way. So,
Yeah,
um,
yeah. I had never heard that. I'm gonna start using that.
okay.
Yeah, that's why I keep telling them, like, you have the option of doing the surgery anytime. That's up
Yeah,
to you. The doctors give you a choice. At least try physical therapy and see where this is going. So yeah, definitely that works.
yeah. And
What?
even going back to, oh, I'm sorry, yeah.
No, please go ahead.
I was gonna say, going back to the preventative care, it's why, because the argument that I hear from people is a lot of times like, why would I wait? Why not just get it over with now?
Yeah,
Why would I wait? But again, to our point before, like you'll be better in the long run if you
yeah,
take your time and do the prehab now and then get it. So again, it's one of those things where it's not just we're not like car parts. You can't just go to the shop and get a new blank,
definitely.
right? It's our body needs to adapt and needs to kind of heal around this new surgical intervention. So yeah, I think the preventative care is becoming more
Mm-hmm.
popular.
Yeah, lately it's becoming more popular. Movement therapy, movement is lotion, motion is lotion. I'm hearing all those terms, and my patients are
Yeah,
coming
yeah,
up with
yeah.
those terms. So I'm so happy to hear
Yeah, it's
them
good.
getting educated about it. Yeah.
Yeah,
What are a few common injuries that you come across in your practice?
yeah. I see a lot of sports orthopedic injuries. I treat a lot of athletes in the San Diego area. So runners with knee pain, um, post-op ACLs, post-op hamstring repairs, um, lots of low back pain, um, lots of shoulder pain with pressing. So a lot of just like the common gym-related injuries. Um, so yeah, not a ton of post-ops. A lot of post-operative patients. They need the visits. They go in network. I'm an out-of-network provider, so I think I think for the most part, I'm doing lots of conservative treatments. I'm also doing lots of treatments of people who have tried the run-of-the-mill style physical therapy in their past and it didn't work out for them. So I like to think that my style and my model is a little different than the in-network style.
Why did you choose out of network practice?
That could be a whole separate conversation, but uh, I think in short, I've been doing this for a long time, and
Right.
I think at the end of the day, my path in a physical therapy practice or career was always met with the same crossroad, no matter how long I was there, and it was
Right.
always some type of compromise for the quality that I felt a patient deserved and needed, that had to be compromised due to something that was, you know, a yellow tape that I had to fight through, or whether it be an insurance company dictating my care, or a surgeon dictating my care, whatever it may
Right.
be. So I think that, you know, I think that was a big thing. Was just being able to provide the quality of care that I felt people deserve, that really was just between you and me. You know, there was no third party to get in the way of our goals. So um, I think it was something I never really wanted to do, if I'm being honest with you. I kind of prefer to be in network and see everybody.
Right.
I'm a big believer in, you know, this is expensive and I don't like that it is. So I try to treat everyone I can, but you can't help everybody, and that's been something I had to deal with. But
Yeah.
I find that in this style practice, the people that I have the opportunity to help, I can, and that's left me with a lot less sleepless nights than previously.
See, that's the difference between a good therapist and actually a bad one, because you know this quite well because you are from the East Coast and there is nothing like hidden from you in the
Mm,
practice on the East Coast. There are practices that just give e-stim 15 minutes e-stim, and that's the whole treatment. And it's so disturbing to see that. I get it, like when you're starting off, you have loans to pay, bills to pay, taxes, rent. It's not easy living in New York. It's not easy living on the East Coast. But that does not stop me from being a bad therapist. It should not stop anyone from giving the best care that you are supposed to give it to your patients.
yeah, yeah.
Yeah.
I feel like it's, you know, I've been practicing a little bit longer than you have. You know, so
Definitely.
it's you know, it's hard. That's kind of what I always felt. And I'm lucky enough to I've had great mentors in my career. I've had great jobs. I've had great people to set the standard.
Yeah.
Um, so I always felt like, I felt that was important to me, was to live up to that standard. So I feel like it was easy for me to, or I guess I should say it wasn't easy to not give in to that urge to just kind of say like, well, you're getting the 10 minutes of e-stim so I can do this documentation that I've backed up, you know? So
Mm.
I get it. You know, I've been doing this for almost 10 years and I can see why and when clinicians kind of mail it in. You know, it doesn't get any easier, doesn't get any better. You know, so it's that's the crossroad that I would hit also from a personal standpoint
Yeah.
was, um, you know, it was how can I prevent my own personal burnout? And
Mhm.
that was a big crossroads for myself too. Is, you know, I wanted to be able to give the quality of care that I had the energy for. And if you were my 24th person that day, you weren't getting my 100%. You know,
Yeah.
it's that simple. And if you were one of four people that were there at one time, you were only getting 25% of my
Correct.
maximum care.
Correct.
So, you know, I think that ate at me a lot. So I think that, I think that that's kind of what, as a young clinician, that's what I would kind of hopefully, instill in you, is would be like, you know,
Definitely.
continue with that standard of care, because, you know, any time that is going to be compromised, you know, there's something out there for you that is going to not make you do that.
Mhm.
So yeah, that's the tough part of the business that they don't teach you in school, you know what I mean?
Yeah, definitely. I 100% agree with whatever you said. Lucky enough, I have also had a good employer, so she really understands that you're not a massage therapist, you don't do massages, so just stick to your physical therapy, work on strength training, and actually getting the patients better. And she allows me to give a good enough, full enough session. But it's so much you can do, you know, like you said, small battles. When you have four patients, it's so difficult to focus on all of them, trying our best, you know. There are days when we see 30 plus patients with just another aid, and you have to still be up there, because if you are tired, then what's the point of the patient coming to you?
Yeah, right,
You
right.
know?
Yeah,
Yeah.
it's like that might be might be the 34th patient you've seen that day, but you're the first physical therapist they're seeing all day, right? So, that's kind of built all week to get to your session. So,
Yeah.
you have to think about that when you're on your 34th patient that day. It can be tough for sure.
Yeah, definitely. How many patient count is there? Is it common in California?
About the same. I've been doing this style of cash-based business for about a year and a half.
Mm-hmm.
Prior to that, I've been a couple different settings, but I would say for the most part, it's about the same. Between maybe 15 to 25 people in a day would be like the standard in-network style. I was at Kaiser Permanente out here in California before this. It's a pretty world known conglomerate of healthcare, especially in California. So that's a style it was pretty hustle bustle.
Yeah. You like it. You must be used to it by now.
Yeah, California's not so bad. It's okay. I come back to the East Coast every now and then, but I think we're here for a little bit longer.
Yeah. No, definitely you should have practice, and California has one of the best practices, I think, after New York, New Jersey, if I'm not wrong.
Yeah. Most of my career was in Pennsylvania. That's where I spent the first half of my career, Philly. But it was quality care in Philadelphia as well.
Yeah.
So I think the tri-state has it kind of figured out a little bit. California has its own issues with reimbursement and that type of stuff too with insurances. But again, that's why I kind of got out of that game,
Yeah.
and I don't really deal with insurance anymore. So it's been nice.
Yeah, I love that. Maybe someday I start my own. Just give me cash. All I need is cash.
Yeah, that's right.
That's funny. But yeah, how do you approach fitness? How do you look at fitness, personally speaking?
Yeah, I think on the same realm. I think I was I was an athlete growing up. I played lacrosse in college. So I think a lot of my knowledge growing up in the fitness world is a no pain no gain
Yeah.
style, right? So it was very much like beat your body down, work hard, no days off style. And I think that after kind of the knowledge I have now and kind of maturing physically and mentally over the last 15 years or so, I think I saw that there is a smarter way to train and to approach fitness and health. So I think where I previously maybe beat my body down, I like to think that I'm caring for my body now. And I think that in doing so, I'm doing athletic and physical feats that I've never done before. I'm stronger than I was in college.
Mm-hmm.
My conditioning is better. I'm smarter about my recovery,
Mm-hmm.
and I'm more kind to myself in terms of uh, my self talk. I think that was a big part of the sports psychology I learned a little bit in towards my end of my senior year, my postgraduate was the mental side of sports medicine. So I think that I just continue to grow, and I feel like I've gotten stronger physically and mentally from it. And I'm 35 now, and I'm not slowing down anytime soon.
Yeah. What are a few changes that you made, the small changes that made you, better and the person that you are today?
I think from a mental side, I would say gratitude. Being trying to be more patient. I definitely have to give that credit to my wife. She I like to think that's she for sure changed me for the better. So
Yeah.
I think again, kind of being a bit more patient, a bit more kind, a bit more
Yeah.
grateful, and giving myself grace, giving others grace. I think that's kind of been huge for me. I think physically, again, kind of just being smarter, more intentional with my movement. I think unfortunately for me, I think I fell under the same block that most young athletes do, which is just like you just did what you did in college,
Yeah.
right? So assuming that that's what was good for you, right? but in essence, like what your college coach gave to you is just what their college coach gave to them 15 years ago, you know? So um, I think that's kind of the big thing that I discussed with a lot of my athletes in here is the same type of deal. Like, um, you know, I should be able to do X, Y, and Z. And it's like, what makes you think you should be able to do that? You know, like why is that even a thing you think you should be able to do? You know, so I think I think being smarter about being able to assess my clients, go through a checkbox of what you need to do to achieve X goal, and start checking the boxes off. So I think that's kind of what I've done physically for me, which is previously just like throw the kitchen sink, go for the sprint work, do the
Yeah.
hit workout, do the CrossFit, you know. So I think slowing down and doing less, I've gotten better.
Yeah. Two interviews back, the not the last one, but the one before that I had, there was something that the therapist said, PT again, practicing here in New York, 41st Street, Madison Ave, and he said, less is more.
Yeah, for sure.
So it stuck by me, and I can really see that, you know, doing less, you are going to do multiple things, but then taking a step back, doing less, and figuring out where you're supposed to focus on matters.
Yeah. I think that also, you know, the idea of like consistency and seeing it over time, you know, I think a lot of people, whether it's rehabbing an injury or like trying to progress in their fitness, they're like that little kid that's trying to
Yeah.
measure themselves every day, right? Like you don't get stronger at the gym on
Yeah.
Monday. You know, you didn't get stronger that day. You got stronger Monday after Monday after Monday after
Yeah.
Monday of, you know, so I think that kind of throwing your eggs in a, like, let me see, like, what's going to keep me moving over a 6 month span.
Hmm.
Like that's strength, right? So if you're beating your body down and it's going to make you take the rest of the week off from work, or now your shoulder's bugging you, it's like, did you get better over that 6 months, or did you blast it on that Monday and then you had to take 3 weeks off? You know, so it's, I think people kind of have that tunnel vision on
Yeah.
that hard workout that, you know, burned X amount of calories, but it's like you just need to keep moving.
Yeah. Consistency. It's a key. Yeah. Can you tell me a little bit more about your journey, how you got into medicine and medical school, you got into PT school and your practice, because you have a background of practicing for so many years in so many different facilities, in network, out of network, and then finally owning your own business in California, no less. So
Yeah.
tell me a little bit about yourself.
Yeah, I would say pretty typical like physical therapist story. You know, I was a young athlete that had lots of injuries and, you know, went through the surgery and rehab process. So I think I always knew I wanted to do something in medicine. You know, I had you know, aspirations of being a doctor. You know, I wanted to be the only person in my family to go to college, and not just that, I wanted to be the only
Yeah.
doctor, right? So you know, I kind of deviated a bit more towards the sports medicine realm. So I think in doing so, it led me back to that physical therapist that I worked with when I was a young athlete. So um, that was kind of what drew my passion to it, and that I was hooked. You know, I think at 16, you know, I got my first, you know, college, you know, offer to play at the collegiate level, and that was when I kind of was like, all right, maybe college and doctor and PT is a reality for me. You know, so um, that's what kind of, you know, that's where my journey started, and
Yeah.
then you know, I would say physical therapy, getting into PT school was a journey. You know, it's not easy, and I didn't get in right away. I'm not ashamed to say that. So, you know, it took me another year to apply and to get some grades up, and to attempt to test well on the standardized test that is archaic in
Mm.
in trying to get into grad school, the GRE, which doesn't test any of your knowledge for healthcare,
Yes.
right? But I always kind of, I think that was a great journey for me. It was that year that I took in between. You know, I got my CSCS. I started doing personal training.
Yeah.
Um, I did one-on-one sessions, so it really kind of got me into exercise prescription and making a program, progressing a program, things that you don't really learn a whole lot in PT school. So I felt like as I got more medically based, I was just stacking skills on different skills. So I felt like that kind of gave me a bit of an
Right.
edge in the sports medicine realm when I graduated.
Right.
Um, yeah, and I got lucky. You know, I got great offers from um, other clinical internships. I had opportunities fall through that opened doors for other ones, and ended up in one of the best PT practices in Philadelphia, the Vincera Institute in South Philly. And I was there for almost 4 years. Learned under some of the best surgeons in the world. You know, are there. The head athletic trainer for the Philadelphia Flyers was the owner of the clinic, so I got to see NHL players. I got to work with NFL, NBA, Major League ball players. So I got to see the highest level of competitive athlete you possibly can. And I got to work with them. I got to put my hands on them. So that was an incredible experience. And then, that we spoke a bit kind of coming into this about my journey to the West Coast.
Yeah.
Was my then girlfriend, now wife, decided to pick up and move. You know, we both had dream jobs, and we were like, there's something bigger out there for us together. So we packed up and moved, and we started working together doing travel PT. She's an occupational therapist, so we got to work together and travel the country for
Yeah.
a little over a year, and then yeah, I started catching. I caught on with an NFL player. I was a personal physical therapist for an NFL player for about 6 months. That's what took me back out to California, and that was where my dream was going to come true. I was going to be a personal PT for NFL players in Los Angeles, and then COVID put that to a screeching halt. So we got to California, and it was like back to square one. Where do we, let's get back into the clinic, back into the paycheck, and so that's kind of where I guess this new journey kind of began. Was like, all right, like, I'd reached the top of the mountain peak, and I was doing what I had dreamt I wanted to do, and then it was so fleeting. I was like, I need to do something where I can take all that skill and all that knowledge and apply it to the people that like I really want to be treating, which is like, everybody, the everyday athlete. They can't get that quality of care. So that was probably like a 2 or 3 year journey to find this and open this up. So that's, I've been doing this for a year and a half. So that's the shortened, abbreviated version of my 10-year career.
I love that. It's still not late to be. Maybe the NFL players can come to your cash-based practice and pay in cash.
Absolutely. Hey, they'll pay just like you pay. Where otherwise, like, otherwise, I was at the Vincera Institute, and they've got the best insurance out there.
Yeah.
You know what I mean? They don't pay a dime when they walk in.
Yeah.
We got platinum, but you might be paying a $75 copay to see me, and they're seeing me for free. So that was a big moment in my life where I was like, this isn't right. This isn't fair. So so that's, if they want to come see me, they'll get the same treatment that you get. You know what I mean?
Definitely. Yeah, see, that's something that I really like about your practice. And how is it working with an OT and being married to an OT? Tell me a little bit more about that.
Yeah, it's great. I think like I said before, she changed my life for sure. I wasn't this jovial kind of, I had this inner kind of like chip on my shoulder, like I deserved more for no reason. You know what I mean? So I think that she grounded me, and I feel like in doing so, like I've mentioned on the, when we were chatting before too, like she's working just as hard, if not harder than I am. I get to be on here and highlight my day. I show you the 8 or 9 people I treat that day, and how hard I'm working on my business, and she's working harder than I am. Like, I'm up in the morning, she's up before me, she's doing her paperwork, and she's not in the light like I am here on Instagram, but I think that she is a motivator because she's the definition of a patient first practitioner. So the standard super high in my own household when I see her, and that she's making little arts and crafts for her kids every single day, and I'm complaining about going in to see like 5 athletes in the afternoon or something. So it's special to be able to share in your work like we get to do, and we got to work together. We got to work side by side, and we get to treat the same patient on the same table at the same time. So there's not a lot of partners that get to say that they were really able to be engulfed in every aspect of their partner's life, and I have been.
I take the blame, and it is my fault. Apologies to your beautiful wife for not giving her the light. I think she deserves a much more light than you. I'm
For sure, absolutely. She's
I'm
my she's
women, team women all the way.
she's my she's like my Instagram boost. Every time I feature her, all my followers are all like, woo.
Yeah,
They want to see more Jenna, more Jenna. So
yeah, we want to see more Jenna. But yes, we will do another session with both of you. So, I can hear her complain about you a little bit.
yeah, she will for sure. You guys, I'll just scoot on out of the. You guys have your own little discussion on here for sure. I'm sure she'll go on for days.
Yeah, that's funny. Tell me a little bit about the OTPT practice, the similarities and the differences, because I haven't had this opportunity on my session to ask anyone about that. But since you work with an OT so closely and you know them personally also, tell me a little bit about like their pros, the cons, in the sense how they affect physical therapy field.
Yeah, I think you're working directly with them. So depending on the practice, if it's a hospital setting, um, usually you'll co-treat. So the PTs, and I guess in any setting really, PTs are kind of um, more gross function, right? So it's
Correct.
walking, it's standing, it's balance, it's
Mhm.
bed mobility. So big, large muscle groups, big, large movements. Occupational therapy, even though occupation is in the
Yeah.
word, it can or can't have something to do with the job. It's usually more fine motor, more functional based in that capacity. So your OT is working on hand skills, a ton of hand work. Your certified hand specialists are almost always occupational therapists. They're doing everyday activities. So in the hospital settings I've worked on, I'm trying to get the patient to stand up straight and get input through their feet,
Yeah.
and Jenna's working on putting lotion on their face and shaving and that type of stuff. So it's a very much like a team effort, and it's
Yeah.
collaborative, and it's interdisciplinary, and it's a super fun way to treat. Um, she's in a pediatric setting now, so you wear lots of hats when you're a pediatric occupational therapist. So
Yes.
she works a lot with different spectrum of autism, Down syndrome, lots of behavioral type of issues, learning adaptive type of techniques for the kids in the classroom, different feeding techniques for the kids. So, food aversions and picky eaters and that type of stuff. So any day she's wearing 25 different hats. So,
Yeah.
and the big difference with her is the paperwork too, right? Like, you understand the big issue with documentation with our profession. It's brutal. So she brings work home with her, and mentally, physically, but again, like I said, she sets the standard for patient first care, and um, she won't complain. She might complain to me for a little bit about it, but then she'll apologize right afterwards for complaining about it, because that's just the way she is.
Yeah.
So she's been doing it longer than I have, and I've been doing PT for 10 years. She's been doing it for probably almost 11 or 12. So she's a seasoned vet, and she still brings it every single day. Um, so she's definitely inspiring. I got to witness it firsthand. So
Yeah.
shout out to all the OTs out there. April was Occupational Therapist Month, so make sure you give a shout out to your OTs over there.
Definitely. I didn't know April was occupational month. I know September is physical therapy, World Physical Therapy, September, if I'm not.
Yeah.
But OT sounds so much fun with like teaching them how to shave. I know they're teaching them how to get in and out of the car,
Yeah.
um, in and
It's
out.
for the kids. It's organized play. It's great. That's their job. Their occupation is playtime, right? So, it's intuitive. It's creative. She's the most creative person I know. So she gets to apply like her best interpersonal skills to her profession every single day. So it's just a nonstop like creative juices flowing for her. So it's a ton of fun to watch them do their work.
I love that. And it looks like she really enjoys doing that every step of the way.
Yeah, that's her passion. She loves it.
Yeah. Where do you see your business or your practice going from here?
Yeah, I'd love to grow. I'd love to right now I'm in a gigantic CrossFit gym, so I have all this space.
Yeah.
And I try to keep my schedule as late as I can for my own mental health as well as availability, So I want to be able to I want my clients and new clients to be able to reach out and say, I've got a problem, can I see you tomorrow or the next day? Like I want to have that availability for them. I know that that's a problem in our industry is I've got a problem today. I need help now.
Yeah.
See you in 3 weeks, So, so I'm getting busier, and that's, so that's a good thing. But I'd love to bring on another therapist and grow my practice a little bit and be able to grow my reach. I can only treat so many people in a day and a week, right? So I'm very, very passionate about this style and treating the people that I treat. So I'd love to be able to just do that more. So that's kind of where I see my practice going, is just being able to bring like-minded clinicians in with me to just do what they do as well. I don't have, this isn't like the Coleman PT way. This is just quality physical therapy. So I think that's kind of what I want to cement into the San Diego area, and as well as virtually, helping people from all over. That's why I do the virtual care too, is just to be able to put hands on more people.
Yeah, definitely. Does this interview count as interview? Am I being hired?
Let's chat. Let's go. Do you do online therapy as well? Do you do virtual work?
We have telehealth, but again, with in network, the insurances just allow the initial evaluation, no daily um, uh, visits. So I've done a few IEs with a few patients online, but yeah, they don't allow. That's why I hate the insurances to some extent when it comes to telehealth and technology, because they're falling so much behind while the world is growing and catching up.
Yeah, yeah. I think it's that's part of it too. Is like we have this technology, let's use it. And I feel like it's always just like we're so far behind in the times of the inertia to make change in our industry is so tough, right? Health in general. So
Yeah.
that's kind of why I think people are kind of taking it upon themselves to just kind of say like, we'll do it ourselves.
Yep.
I'll do virtual care my own way, and
Yeah.
this I'll deal with the repercussions later if there are any.
Yeah. For someone who had such impact because of COVID, the importance of how much online therapy is. What are your thoughts on telehealth?
Yeah, I mean, I think I went to school and I'm passionate about my in-person care. I really love to I don't think there's anything quite that promotes a buy-in from me than looking someone in the eyes in the same room and hearing their problems, right? Like that'll really kind of that I take that accountability very seriously. So I think that I'll always have a passionate for the in-person treatments, but also know that not everybody can get into in-person, So I think that depending on the injury or depending on the issue, there's nothing wrong with trying to do some targeted training and some targeted treatment virtually. So it is a world that exists, and people do get better. I've been doing it for almost 4 years now of the virtual work, and people get better. I think that you have to be selective, you have to be careful, and you have to make sure that you're working with people that you think you can help. But it works for sure. And I just think that it's growing, and I think that people are becoming more aware of it.
Yeah, definitely. What is one last piece of advice that you would like to give for all the viewers out there?
Choose physical therapy.
Yeah.
we're here to help. And if you have questions, if you don't have accessibility to a physician or a team like that, use this. Like,
Mm-hmm.
the Instagram is toxic,
Yeah.
but it can also be revolutionary, and it can move mountains. And the accessibility is right here. Like, I'm talking live to you right now. I don't know how many people are watching this, but this didn't exist 15 years ago, and it didn't exist 10 years ago when I started doing physical therapy. People weren't really doing online care. You had some people putting out their stuff online, but this style interactive communication directly to the patient never
Yeah.
existed. So, you know, email, message me or email Barba or whoever, but just ask the question and see what you get. Can't hurt. And try physical therapy, and if you didn't like it, try someone else and try again.
Yes, definitely. That was such wise words to at least not stop doing physical therapy. Physical therapy does not have side effects.
Right.
If done right, there are no side effects. It's just, progress. And it's one body. I don't mean like you will not be sore or you'll not have like setbacks at some points because of weather, because of other things, stress, but there are no side effects. So it's a beautiful field, and I think everyone who needs therapy, even if it's pre-rehab, they should just look into it and they should get to it.
I agree. Yeah, completely agree.
Mhm. Thank you so much for taking the time out and speaking with me today. It was such a lovely conversation, and
Yeah.
I really am looking forward to meet Jenna and speak with her.
Yeah, see if I did the description of occupational therapy justice for her. I hope I did okay.
I'm gonna send a video to Jenna and just be like, okay, this is what your husband said. Do you approve? Do you agree? I think she'll be
Thank you.
happy. She sounds like a sweetheart, and she works with like kids. It takes so much effort. Personally, I've treated so many kids, and I know how much effort it takes just to do physical therapy for them.
Yeah.
So that really requires patience and the insight that to see patients with such care and adore, and to see them beyond their limitations.
Hmm.
She's really making such a huge
I
difference.
think she needs to be the next guest, and that's our friend Allie. Allie, she is the best. See, thank you, Allie.
I agree. Well, thank you so much for taking your time out.
Of
I wish you and
course.
Jenna a lovely evening, and take care of yourself. Bye
Thank you.
bye.
You too. Bye bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.